I am Dr. Emily Murase, and welcome to our session today, Alone, Building Paths from Loneliness to Connection and Belonging, brought to you by the National Council of Jewish Women San Francisco and the International Alliance for Women, with sponsorship by the United Nations Association of San Francisco. Before I get started, I'd like to do an informal poll of the audience by a show of hands, either in the reactions button or physically a show of hands. How many folks here are from Africa? Where are our African sisters? Do we have any African sisters with us today? Oh, yes. Welcome, Alta. What about Asia? Do we have any Asian sisters with us today?
Yeah, sure. I'm from India.
Oh, fantastic. Welcome. Welcome, Seema. Where are our Australian Oceania sisters? Do we have anyone here from Australia, Oceania? All right.
I'm also from Asia, Emily. I'm also
Okay.
from Asia. I put a thumbs up,
Welcome.
you know,
Welcome.
in my reaction.
And where are our sisters from Europe? Do we have any sisters here from Europe? I see many folks from the International Alliance for Women. We're so delighted to have you. Next is North America. Do we have folks here from Canada, United States? Give us a wave. And what about our sisters from Central and South America? Do we have any folks from Central, South America? And did I miss anybody? If I missed someone, please unmute and tell us where you're from. Did I miss a part of Antarctica? Arctic?
Switzerland.
Switzerland, very welcome. Welcome. Delighted you can join us from all corners of the world. So the full biographies of our extraordinary panelists are available on the backside of our event flyer, and we'll put the flyer into the chat. So I won't be spending a lot of time, otherwise we would be here all day on our distinguished speakers. But I want to start with offering welcoming remarks. Nancy Kirshner Rodriguez is a board member of the National Council of Jewish Women San Francisco and former executive director of the California Commission on the Status of Women. She also worked at the U.S. Department of Labor Women's Bureau in the Clinton administration. Nancy.
Good morning, everyone, and thank you so much. For those of you that don't know a lot about the National Council of Jewish Women, it was founded by a courageous woman named Hannah G. Solomon. She dared to make change, and the National Council of Jewish Women, and of course, I will say in particular, our San Francisco region has embodied that effort for our over 100 plus years. We work to build connections, advocate for women and girls, and create a world where we can be and see the change that we want. And so we are thrilled to have all of you here together, and we look forward to a very important discussion this morning, and thank you.
Thank you so much, Nancy. Next, we will hear from Marian Boca, acting president of the International Alliance of Women and principal of our consultancy for human rights and gender issues, who is joining us from Berlin, Germany. Marian.
Thank you, Emily. Thank you, everybody from San Francisco. Good morning or good afternoon, good evening for everybody else. I thank you in the name of International Alliance of Women for partnering with us in this very important parallel event on this very important and under-researched topic, which has gained a lot of more importance. And thank you for the whole Council of Jewish Women in San Francisco. Loneliness seems to be under-researched or just gaining an importance, since it's no longer a phenomenon which seems to be important for, let's say, just elderly people or specific groups. It is and can come to us in a pandemic or in a term of crisis at any time for globally masses or all of us. Certainly in a specific moment, we are behind this computer screen and only seeing each other on these little windows. But also I was asked to speak about another type of loneliness we experience these days in Ukraine. If there's a country, and this globally is also visible in many more places in this world, but today let me talk about Ukraine. If there's an aggressor, if there's a certain war, people, and especially women and children, feel lonely, lonely from the world, not being seen, not being helped. We have heard so many alarming letters, cries from women, even if they're very well organized in the midst of organizations, networks, globally organized, big families, but it doesn't seem to be meaningful anymore if your country is attacked and under a war of somebody or an army. These women are lonely in the flight, left by their families, or they have to leave their families and beloved ones. They are fleeing with their children in many numbers. Even children are lonely, going with their aunts, not with their mothers, coming with one person, maybe a group of 4 or 5 children. We receive, for example, since weeks, some of them in Berlin in such groups. They are lonely when they arrive here. They are lonely among us, and we try to create belonging. This is your other key term. And this is so important that there is a caring community which will reach out to you and at least try to ease you a bit and give you a new belonging. We can't heal the fact of loneliness in that moment. Maybe later we can heal these consequences of the war, and I hope very soon. But it is so important that our community of women organizations, separate women, each as an individual or as a group, is creating belonging in each and every option, how we can do it. Maybe in technological way, like in Zoom meetings, but also leaving the door, leaving the house, going to these people, going to everybody of groups who become or are lonely. You can never make a mistake asking somebody, do you feel lonely? Shall we spend a little time together? And I think you will explain much more. Thank you for this important event.
Thank you so much, Marianne. We appreciate your words very much. Next, we will hear from Nancy Goldberg, Board President of the Rhoda Goldman Plaza Senior Assisted Living Facility in San Francisco. And Nancy is the reason why we are all here today. She has championed this issue despite the fact that it gets very little attention. She wanted to put this together for the CSW. So we are in great debt to Nancy's vision. Nancy, please share with us the inspiration for today's session.
Well, thank you. I think that living is the inspiration, and hearing people like Marianne, what you just said, I just couldn't be more at one with what you're saying, and it's frustrating not to know what to do. But anyway, I will go on with my remarks. Human trafficking and isolation is happening all over the world during this pandemic. When I first put a panel in place to discuss human trafficking and COVID some months ago, it was focused on young and vulnerable people. But now I also realize that this pandemic of loneliness has impacted seniors in the world that we are living in. Loneliness is a disease, and it can eat away at our hopes for a better future. It has left in its wake the thoughts of suicide, depression, domestic violence, and feelings of isolation. A few months ago, a young person came up to me and said he had been considering suicide during the shutdown. He told me he was lonely and had no friend. His vulnerability was not something I had often heard from boys. This is a medical crisis which has impacted the world that young people are growing up in, from school closures to remote learning, leading to fewer friendships and more time alone at home, unsupervised on the internet. This is a humanitarian pandemic where COVID has disrupted families economically and impacted the dynamics of human trafficking around the world. Nobody is immune because of age, social status, gender, or location. I have also been able to see another side of this shutdown. As president of the board of directors of Rhoda Goldman Plaza, an independent assisted living and memory care facility in San Francisco, I have learned so much about the challenges of living day to day with this epidemic for seniors. Before the epidemic, active residents were encouraged to jog, walk, see friends, and go to the gym for exercise. Friendships were made, and very often, their social life included meeting for meals at the community dining room for lunch or dinner. Then came COVID, and the CDC state guidelines said dining rooms in our facilities had to shut down, and things changed dramatically. Isolation among seniors has taken away the mobility and sociability that many had become used to. According to Kelly Schmidt, a Seattle-based health and science writer, the bottom line is that isolation and loneliness are tied to poorer health outcomes, including rates of heart disease, worsened diabetes, poor sleep, and Alzheimer's. It has also been said that lack of social contact has been found by researchers to be just as deleterious as smoking. At Rhoda Goldman Plaza, Adrienne Fair, who is an RN, MSN, and the Assistant Executive Director, in collaboration with the dedicated staff, has helped to lead the residents to experience less isolation through following a plan to keep everyone as safe as possible and making the challenges of a lockdown palatable. It is not easy to do. But I want to share a few of the programs that we put into place that may be helpful to others. Family visits were suspended, but we never completely stopped them, as many places did. It is devastating not to be able to spend time with loved ones, which was the case in many nursing homes around the world. So in senior living environments, whether living at home or in a facility, learning how to use Zoom and other online platforms has been especially good for the elderly to connect with family and friends who live close or far away. It's also useful for doctor's visits and group discussions. But unfortunately, not all seniors are comfortable with technology. However, more elders are starting to adapt to this change in their lives. Clearly, this does not replace human contact. The power of touch and care is irreplaceable. Day-to-day caregiving plays an important role in this respect. The majority of residents who receive hands-on care or medication assistance from a trusted caregiver with whom they have daily contact can turn into a very special interaction with people they trust. A lockdown is never going to work for everybody, and many take it very hard. However, in some facilities, the residents themselves took it upon themselves to enforce a mask mandate, knowing that they were all in this together. It must be said that many residents found a creative way to balance safety and social life. As of today, the CDC rules have changed once again, and visitation in residential care facilities has become more relaxed. Dining rooms have recently reopened. This has been seen as a return to normal, but make no mistake, this epidemic is still out there, and it's watched very carefully by our staff and the facilities all around the state. Everyone entering is checked and temperatures are taken. And if there is a return to lockdown, dining rooms will again close. The residents' well-being is the #1 priority. I am fully aware that not everyone is able to be in a senior residence or long-term care facility. However, there are some things that can be mimicked in your own home, city, or place of residence. So I want to give you a few suggestions. Look for those in the community where you live who may be able to assist with the donation of computers and can instruct others on how to use Zoom, get email, provide daycare, do grocery shop, shopping and other activities. It is also important to keep an eye on all scams that seniors can be drawn into. We shouldn't portray all seniors as lonely dependents. I find that as a senior, having a purpose is something that keeps me more alert. Caring for my fellow citizens, no matter what age or no matter where, has followed me all my life. And now I hope I can make a difference in the lives of seniors as well as young people who may be feeling hopeless and helpless. Thank you very much.
Thank you so much, Nancy, and again, for all your work in this area. Next, we will hear from Dr. Ellie Pelk, Associate Clinical Director at the Jewish Family and Children's Services Center for Children and Youth here in San Francisco. Her expertise is in applying evidence-based practices using cognitive, behavioral, family systems, and play techniques to help rebuild and repair family connections. Ellie, please.
Thank you very much, Emily. It's an honor to be together with you all, everyone, today. So we humans were designed to be connected. We are neurobiologically wired to need intraconnection. Relationships are what shape children's development. And the developmental needs met from relationships change throughout phases of development. So what happens to our mental health when we're told that in order to stay safe, we must isolate and quarantine ourselves from our families, friends, neighbors, and communities? Our core need for intraconnection is compromised. What this has done to childhood development and family functioning is profound. For example, there's been a 50% increase in mental health related visits to the emergency department since the pandemic. But our capacity for resilience, healing, and growth is even stronger. We're seeing the impact of the pandemic largely as either rigid or chaotic reactions to stress. Many of us had underlying predispositions to these reactions, which is why the environment of the past 2 years has led to this mental health crisis. Many of us in the mental health field are contextualizing the past 2 years as a collective developmental trauma. So some of the examples of rigidity that we're seeing would be symptoms of isolation, anxiety, withdrawal, hopelessness. We're seeing babies and toddlers clinging to their primary caregivers and appearing fearful of new and different people. Some kids don't want to leave their rooms or homes. Some are refusing to go on walks, hikes, or bike rides with their family. Some youth have resumed co-sleeping with parents at ages much older than typically accepted in our culture. We've seen children with more symptoms of panic and OCD than ever before. Some of the symptoms of chaos that we're seeing is that we're treating children and teens with a difficulty to fall or stay asleep. Their bodies are in a constant state of alert. We're seeing heightened risk-taking, substance abuse, impulsivity, aggression, cycles of binge eating and purging. And unfortunately, the list could go on. So what does it take to regain balance away from these extremes of rigidity and chaos? Balance would be moving the pendulum from these extremes that facilitate trauma and stress and uncertainty towards concepts such as resilience, healing, growth, connection, and possibility. So here are some concrete examples of ways that we are working with children and families to regain this balance. So number one is finding new ways to seek connection, because relationships are what facilitate resilience. More children, parents, and families are reaching out for mental health support than ever before. Most therapy practices are hiring and expanding available services. This can be the exact type of connection that children and families are needing. More pets than ever before were adopted during COVID. I don't think that's a coincidence. And some limited screen time where children are playing online with their friends can be helpful and healing too. Cognitive behavioral therapy is a widely used evidence-based treatment to work with children, teens, families experiencing mental health challenges, including depression and anxiety. So for example, cognitive interventions would include the act of naming and labeling that we've experienced a collective developmental trauma. This can be the first step towards healing. And shifting language around connection can be extraordinarily meaningful. So for example, loneliness is about our perception of our relationships. It's our state of mind. It's not necessarily indicative of our actual relationship connections. Instead of using the language of social distancing, we in the mental health field recommended instead to use the concept of physical distancing, that we can be apart from one another and connected. Behavioral interventions include that we're working with children and parents on readjusting to new norms. Restrictions and mask requirements are reducing here in California. Many children and parents are needing assistance with transitioning to some of these pre-pandemic practices. And we can do this through gently guided exposure interventions. Slowly over time, building comfort and confidence to be able to re-engage with one another together in person. We've been teaching coping skills such as mindfulness, meditation, breathing, and visualization exercises. We're encouraging self-care practices like daily exercise, sleep hygiene, and healthy eating routines. We've seen that families have devised ways to remain connected through new rituals conducted over Zoom. Some families have said they grew closer to distant members of their families due to the pandemic. And this is even true in my own family. So for example, my large extended family planned monthly cooking Zoom dates where we simultaneously cooked family recipes together. And it was an event that we all looked forward to. So these are all examples of cognitive behavioral interventions that have been extraordinarily helpful with healing. So another type of therapy that I am trained in is feminist therapy. And it's actually what I did my dissertation on several years ago. And a core tenet to mental health treatment in a feminist therapy perspective is the intentional use of consciousness raising and advocacy. So I don't think it's a coincidence that we saw a dramatic rise in anti-racist movements, efforts to work towards environmental protection, among many other advocacy efforts that we've seen during the past 2 years of the pandemic. There is immense healing and connection that can be cultivated through action. Perhaps some of you may even be experiencing this through this conference. So in conclusion, loneliness is merely our perception of our relationships and our state of mind. It's not necessarily indicative of our actual relationship connections. This leaves me more hopeful that by sharing this information more globally, we can assist one another with shifting our perceptions and cultivating connection in new, meaningful ways. Thank you.
Thank you so much, Ellie. That was so informative and heartening that there are many strategies that we can pursue to promote connection. Next, we will hear from Dr. Kiyomi Cohn-Amerix, Medical Director of the San Francisco Autism Evaluation Center at Kaiser Permanente. Kiyomi's expertise is in treating adult and children who experience trauma. And she has a very deep background working with human trafficking survivors on many social justice issues. Kiyomi.
Thank you, Emily. So it is really an honor to be able to speak to this. Sorry, my computer was a little glitchy this morning of all mornings. But I do want to just address everyone and say hello, good morning. I'm going to really focus my talk on how isolation and loneliness is really affecting the mental health of our young people, and how COVID-19 really exacerbated this already growing mental health crisis that we've been seeing in our pediatric population. So to begin, and to kind of also reinforce what Dr. Pilk said, is that social isolation and loneliness are often used interchangeably, but they really are distinct phenomena, where social isolation is more defined as a lack of connections with society. Loneliness is a subjective feeling of being alone or isolated. And loneliness can occur in individuals even when they're around other people. Social isolation does progress into loneliness at times, and social isolation and loneliness kind of have this negative impact on one another. Both have been associated with the development and actual perpetuation of mental illness, and also contributing to a poor physical health outcome. What we do know is that loneliness does contribute to the development of depression, anxiety, paranoia, social anxiety, and substance abuse, as well as some other mental illnesses such as ADHD as well, and increases some of the symptoms that we see in autism. The studies have demonstrated that loneliness is also associated with a greater risk of cardiovascular disease and a weaker immune system. We do see this in women. And our youth, women, and geriatric populations are more predisposed to loneliness than other populations. However, girls and women are often able to directly identify their experience of loneliness, more so than boys and men. In girls, loneliness is often associated with the development of depression symptoms, and mood and anxiety symptoms are often seen in women who are socially isolated or lonely, whereas boys, we see more social anxiety. So COVID and the need to shelter in place has really further highlighted the impact of social isolation and loneliness on health outcomes, especially for our adolescents, our young adults, and girls and women. We've also seen an increase, though, in behavioral challenges for preschoolers and elementary children. So the pediatric mental illness was increasing prior to the pandemic. However, with the social isolation, shelter in place, and with the closures that were needed for schools to observe shelter in place, we actually saw pediatric mental illness surge even more, and now we're actually at crisis levels. And according to the literature, the reason this is important is that 75% of all mental illness usually begins before the age of 24. So we really need to be focusing on this population. And according to the Journal of the American Medical Association and the U.S. Center for Disease Control, emergency room visits for mental health increased between mid-March to October 2020 by 24% for school-age children and 31% for preteens and adolescents as compared to the 2019 numbers. Suicides are also the second highest cause of death for youth in the U.S. In child psychiatry, we also saw an increase of elementary school children endorsing thoughts of suicide and actually participating in some self-harm behaviors. Now, the US is not the only country that was affected, obviously, by the pandemic, and the US is not the only country also affected by this rise in pediatric mental illness. The World Health Organization reported that globally, 1 in 7 10 to 19-year-olds experience a mental disorder. And suicide is now the fourth leading cause of death in the population of 15 to 19-year-olds. So despite some of our telehealth services and our mental health system just really can't keep up with this surge, we really need to be paying attention. We also need to realize that oftentimes the LGBTQ and in the US, children of color were especially impacted by this lack of mental health services and lack of access to medical services. The isolation and loneliness felt by the children and their caretakers is taking a huge toll on the mental health of our children and adolescents. really as supported by the numbers. However, while loneliness can have its negative contribution to mental illness, social connectedness and safe and positive social supports can have beneficial impacts on mental illness. Studies have shown that patients with a strong, positive social network are more likely to recover from an episode of psychosis. And for women, having at least one friend may actually buffer against the perpetuation of ongoing psychological issues. It's also demonstrated that adolescents can combat loneliness by sharing self-information with their peer group. Additionally, when adolescents feel like they have a strong social support, they're more confident to ask for help when they experience difficulties. And remember that girls, it includes teen girls, can more directly identify when they're lonely. So when they have that support system, they're also more likely to ask for help. So given that there's things that we can do that can be protective factors, we need to really start looking very closely at resiliency and what we can do to begin to build resiliency in our children and also within our families. So a really good piece of news is that studies have demonstrated that resiliency is not just this innate characteristic. So we're not just born with this, but we can actually learn it. And we can actually help to build resiliency in families and children. And this is not just that the professionals can do this. This is really anybody can do this. Parents, aunts, uncles, grandparents, teachers, and peers. So one thing that was interesting is that we always know that physical activity is always a good thing, right? We always hear about that. Exercise is a good thing. Movement is a good thing. Well, actually, during shelter-in-place orders, children who were engaging in regular activities demonstrated less mood symptoms, less anxiety symptoms, less hyperactivity, and less inattentive symptoms, and more positive pro-social skills than children who were not regularly active. Additionally, allowing children to express their thoughts and feelings in a developmentally age-appropriate manner is also an important resiliency builder. So allowing younger children, like preschool children and early elementary school children, to express their feelings through play is really an important way for them to be able to relate to us what is happening. We see this often in trauma, that the trauma story is often replayed in play therapy. Elementary school, so the older elementary school children really benefit from having someone to listen to their concerns and provide honest answers, not graphic answers that are not age appropriate, but honest answers. And then children in early adolescence often benefit by reinforcing empathy and perspective taking, and caregivers modeling how they can positively express their thoughts, emotions, and use their coping skills. Older adolescents and our young adult population really benefit by asking their opinion and listening to their answers, as well as creating a safe space for them to kind of reset their psychological and physical being. And then also by the adults in their life modeling self-compassion. So that means we need to learn self-compassion. So encouraging children to ask for help and reinforcing that struggling is not failure. Instead, asking a child, what do you need to get through these challenges? That actually empowers a child and gives agency. And I have put together a slide of resiliency factors and agency. And I don't know if Antonio can put that up. That would be great. And just that agency is actually one of the resiliency building factors that has been studied over and over again. More things are a positive, close family relationship and family connectedness, as well as that family, that child, and that community being included socially. That's actually shown to be a huge protective factor and a building block for resiliency. So as you can see, there are numerous resiliency building factors, and we really need to explore and implement these to help support and to protect our family. Some of these can actually come to us just in regular conversation that we are having with our children. So for example, humor. Laughing, in fact, there's something called laughter yoga where you begin to laugh, and it's actually been shown that smiling and laughter help to actually encode positive memories, and frowning actually encodes in the brain more negative memories. This is something simple to do. Also, active coping skills, which is also on the list. It's actually been shown that active coping skills, so for example, the use of humor, the use of peer connection, and actually build resiliency, unlike passive coping skills, which is sleeping or distraction. So the passive coping skills are more avoidance.
Hey, Kiyomi, just a couple minutes left.
Yes. So kind of looking at our resiliency building blocks, we can begin to add some of these into the daily lives of not only ourselves, but also our children. So in conclusion, there is hope and resiliency can be built. Thank you.
Thank you so much, Kiyomi. Really appreciate all those practical tips on how to promote a connection, particularly with our young people. Next, we will hear from Beverly Upton, Executive Director of the San Francisco Domestic Violence Consortium. She is a local Shiro, a champion of survivors of intimate partner violence. She has dedicated her career to this area, works tirelessly. I'm so delighted to have her speak today about how loneliness can hold domestic violence in place, how connectedness can lift survivors up. Beverly.
Oh, Emily, thank you so much. Well, I just want to thank everybody for this opportunity. And I also wanted to take this moment to thank Emily and Tonia and both of our Nancys for their years of friendship. So thank you so much. It's an honor to be with you today. When we look at the role of loneliness in domestic violence, we can really see it as a partner in holding domestic violence in place. But the good news is that lifting loneliness also may help survivors lift themselves and our communities out of domestic violence relationships or relationships that are experiencing domestic violence. So when we think of loneliness, and I loved hearing that it's subjective, absolutely it is. Partners may, people who are experiencing loneliness may override or ignore red flags when meeting new partners. So if someone displays some of the behaviors that might be red flags for many of us, such as power and control or emotional abuse or hinting at that kind of behavior, someone who is experiencing or perceives themselves as lonely or experiencing loneliness may override their instincts. And all of us have overridden our instincts at one time or another for something, and we almost always wish we had listened to our instincts. And so we do, I mean, and this is part of the dynamics, right? There are more than one person involved in this. And so sometimes loneliness or the perception of experiencing loneliness can make someone more vulnerable because they might be willing to override their own instincts and ignore some of the red flags. So we want to keep that in mind, especially when we're working with young people and their self-esteem and the esteem that they hold in their communities and in their families. We want to make sure that they trust their own instincts. As domestic violence becomes more prevalent in a relationship, loneliness and fear of loneliness may hold this relationship, may hold the person in the relationship longer because of the isolation that they're experiencing. So one of the hallmarks of domestic violence, as I'm sure almost everybody on the call knows, is isolation. Isolation from friends, family, co-workers, and faith-based communities. But also there's an isolation within the person regarding the things they used to really like to do. We have worked with survivors in San Francisco for many years, and one of the exercises that I did as a survivor and that I've done with lots and lots of survivors is going back and thinking about what you used to like to do before this relationship took all of your time and attention. It's very difficult after somebody has been in a relationship for a very long time that has indeed taken all of their time and attention to remember what they used to do. So helping people connect and reconnect, and maybe something new, but reconnecting with the arts, music, theater, dance, pets, we heard today, wonderful. And I would also add sports, getting active, being outside, and nature, which is part of it as well. Healing is so possible in nature. People do not have to be totally forthcoming. It can be a relationship between them and the earth that we're all on and our nature. And so it can be healing before people are ready to talk, if ever, but ready to talk about the domestic violence itself. The fresh air, the animals, the birds, the physical exercise is healing. And so that might be one of the first areas that we would want to help survivors reconnect with. Then I would say another piece that we see as people are reconnecting is still holding the secret of domestic violence. So even though people may be reconnecting with family, friends, their faith community, co-workers, and colleagues, they may still be holding, and probably are, much of their experience. They may not be sharing it, and they may never be willing to share it or ready to share it. But as we heard today from some of our other panelists, especially in women's lives, one friend makes a difference. Somebody that they can confide in. They may not, very often, probably won't, tell everybody everything. It's a big load to carry, but one friend might make the difference. So there are lots of opportunities to reconnect to themselves, right? If we look at the research, I was looking at Dr. Amy Kochak's work. She's a Canadian researcher who really, it was a good stretch for me because I'm usually reading the work of folks that are researching domestic violence. But Amy really researches loneliness across the lifespan. And one of her studies really showed that while the perception of loneliness was very high in survivors of domestic violence, it was not off the charts. It was not different than most of their peers, the level, but the cause, what they identified as the cause of domestic violence, the cause of their loneliness, was very consistent with what we see in relationships that are experiencing domestic violence, which is some self-blame. In Dr. Amy's study, many of the survivors of domestic violence took responsibility in both good and not so good ways, but for their own loneliness. So they saw some of their loneliness caused by, and this is what they identified, personal inadequacies, which may be a message that they received in their relationship. Also, They may connect their own loneliness with this chaotic and unhappy family life. And so this, helps hold this in, right? It helps hold all of this in place. Then there's also the fear of relocation, which scored very high for survivors of domestic violence experiencing loneliness. They expressed concern about relocating away from their partner. So that could be a domestic violence shelter, or it could be moving out on their own or moving with family. But because of what they've been told in the relationship, they may experience that as another factor that will bring them loneliness instead of freedom. So we saw some subtle and not so subtle changes in how survivors of domestic violence identified their own loneliness. So strategies to reconnect, we talked about this a little bit, but reconnecting to people's faith-based communities is so key. And one of the first places of isolation in so many relationships experiencing domestic violence is an isolation in what feels like a lack of time and attention for faith-based communities, family, friends, and these activities. So reconnecting, helping to identify what survivors used to like to do, what they wish they could do with their free time, and reconnecting them with that. And I would just stress this piece around nature, because it doesn't take a lot of self-disclosure. It's a great first step forward. So there are strategies, there is hope, and I'm just very hopeful and honored to be here today. Thank you.
Thank you so much, Beverly. I really appreciate all your experience and wisdom around this issue. I want to acknowledge Linda Kurtz, president of the National Council of Jewish Women in San Francisco, who has joined us, as well as Erin Saberi, who was an architect of the Sacramento Commission on the Status of Women, our newest commission throughout the state. We will have time for questions. We'll begin that after our final presenter, Gwen Harris. Next, we will hear from Gwen, a geriatric care manager with the Palliative Care Program for Seniors at Home, a program of Jewish Family and Children's Services. She'll be speaking on loneliness and seniors to connectedness.
Good morning,
Gwen.
everyone. It's so wonderful to be here. Thank you, Emily. So in 2018, the World Health Organization reported that loneliness and social isolation can be as damaging to a person's health as smoking 15 cigarettes a day. And until COVID-19, it was considered a silent pandemic affecting primarily older adults. Seniors are at an increased risk for loneliness because they are more likely to face factors such as living alone, loss of family or friends, chronic illness, and sensory loss. While living alone, as we said, does not lead to social isolation, it is certainly a factor. Yet it is equally important to consider how often someone engages in social activity. A UCSF study was conducted to examine loneliness and age, and found a relatively high incidence, 43% of people over 60 feeling lonely even when they did not live alone. In such cases, there's often little social contact outside of household members. The social contact does not just refer to spouses, but also other family caregivers. Since caregiving requires full attentiveness of the caregiver, the needs for the cared for person, caregivers become subjected also to the risk of loneliness. Studies have shown that pre-pandemic, 1 out of 5 seniors did not participate in weekly or even monthly activities, and the pandemic only exacerbated this. A Humana study of more than 1,000 adults ages 64 and older found the pandemic took a serious toll on the physical and mental health of older adults. 51% of respondents reported spending more time alone since the pandemic started, and 43% reported spending less time on things that brought them joy. In a similar study in June of 2020, found that 56% of the people over age 50 reported feeling lonely and isolated, which was double what they found in 2018. And nearly half of those polled felt more lonely and isolated in the months prior to the pandemic. So what are the health risks that these seniors are experiencing? Regardless of the causes of senior loneliness, the consequences can be harmful and alarming. Even perceived loneliness is a struggle for many older people, causing increased levels of depression and anxiety among older adults, as well as significant health risks. Evidence shows perceived loneliness can lead to depression, as we said, poor sleep quality, impaired executive function, accelerated cognitive decline, poor cardiovascular function, and impaired immunity. Rates of anxiety and depression among older adults increased significantly during the pandemic. The National Health and Aging Trend Study for patients admitted to intensive care units between 2011 and 2018 were asked questions about their social interactions, such as whether they talk with family and friends about important issues, visit family members and friends, and participate in social events. The levels of loneliness and isolation were ranked from 0 to 6. Each increase in loneliness scores corresponded to an increase of functional disability and death. In the year after an intensive care unit admission, the most lonely adults had a 50% higher rate of functional disability and 119% greater risk of death. In a similar study from the Center for Disease Control and Prevention, they found that loneliness in a senior significantly increased a person's risk for premature death from all causes. It's associated with a 50% increase of dementia, a 29% increase of heart disease, and 32% increase of stroke risk. Suicide is another important problem among older adults. Statistics from the National Council on Aging state that those 85 years and older have the highest suicide rate of any group. It's over 4 times higher than the nation's overall rate of suicide. As high as those figures are, the American Association for Marriage and Family Therapy suggests that the rates for elder suicide are underreported by 40% because these are referred to as silent suicides. These would include overdose, self-imposed starvation, dehydration, and in addition, accidents. The rate of suicide completion of this older senior group is also high due to the lethality of the methods used. Seniors also have higher rates of owning a gun and also having access to prescribed medications. Suicide attempts by older adults are more likely to result in death because older adults are planned more carefully and use more deadly methods. Older adults are less likely to be discovered or rescued. The physical frailty of older adults mean they're less likely to recover from an attempted suicide. There are many factors that contribute to an elderly individual deciding to suicide, but one and the most important factor is loneliness. So what can we do to help our seniors? Jewish Family and Children's Services, JFCS, the studies that show we have different programs that are successful in addressing loneliness that are tailored to meet individual needs, normalize the situation, and resolve underlying issues that contribute to loneliness. JFCS adheres to these best practices by utilizing a holistic and coordinated approach through individual services, group programs, and volunteer-based services. So in terms of individual services, JFCS, we have case management and counseling service that's provided in either a client's home or in our JFCS offices. And this connects our clients with activities. We also remove barriers such as transportation and health issues that prevent our clients from engaging in social activities. Another program we have is home care. Home care is alleviates the social isolation for both the older adult and their family caregiver. Clients who have a caregiver on a regular basis develop meaningful connections with the caregiver and expand their social contacts. We also have group programs at JFCS, and by their nature, they're designed to reduce loneliness, and for many, we've been able to move on to online programs that made these programs even more accessible. The JFCS has been able to provide our clients with tablets and laptops and hotspots, as well as technical support to assist our seniors with connecting to these social programs. JFCS has a number of group programs like L'Haim Adult Day Health, which is a healthcare program where frail clients receive nursing, therapy, and social work services, as well as they participate in activities and have meals. And as Nancy was talking about earlier, we also have Rhoda Goldman Plaza, which is a wonderful assisted living that Nancy talked about earlier. We also have Cafe by the Bay, which is a social group for Holocaust survivors that meets to celebrate holidays, listen to lectures, and listen to concerts. We also have a Skyview Day Club, which offers programming to older adults with cognitive impairment 5 days a week. We have a Widowers and Widows Cafe that socially gathers monthly to support widow and widowers in social activities and in a supportive environment. We also have caregiver support groups and bereavement support groups, which we offer online and in person. We have a wide range of volunteer services. And everyone knows that the act of volunteering, particularly for seniors, is well researched and has been found to be associated with increased socialization. JFCS designed our volunteer programs in a manner so that both the volunteer and the client benefit from participating in this meaningful activity. And it should be noted that over 40% of our volunteers are age 65 and older. So we have a Safe at Home program, which is a telephone reassurance program in which our volunteers call our clients on a daily basis. We also have a senior companion and a palliative care program, which I'm involved in, that matches volunteers with our clients that when we do visits regularly, either on virtually or in person. We have also a grocery running program where we deliver hundreds of bags of groceries to older adults and people with disabilities on a weekly basis.
We have
In
about
summary,
another minute left, Gwen.
yeah, in summary, nearly every program offered by JFCS addresses loneliness and social isolation in some manner, whether it's through the elimination of barriers that prevent an older adult from accessing a program, connecting them to resources, and providing socialization opportunities on a one-on-one or group setting. Thank you very much.
Thank you so much, Gwen. That was a very, very comprehensive overview of things that are effective with seniors. We really appreciate that. So we have, I want to, before we go to Q&A, I want to thank all of our speakers, every one of whom is on the front lines of saving lives. We could not have a functioning society without our mental health professionals and champions. So for the Q&A, if you could please put your name in the chat and we will call on you to ask your question. Please direct your question to one panelist. And I'm going to first call on Allison Brown of IAW. She had a question about resiliency. If you could please ask your question, and I've asked Ellie to respond. Antonia, can we bring up Allison?
Yeah, I was in the next room listening. I wanted to know the qualitative difference between resiliency and resilience.
Unless I'm misunderstanding the question, I think of the words as related, but resilience, I would think of as a noun, and resiliency as, forgive me if I get this wrong, is it adjective?
But you
No,
were using
adverb.
it as a noun.
I think of them as related, that resilience and resiliency as very much related. I don't think of necessarily a qualitative difference between the two.
Yeah.
Just one is a state of resilience and one is the muscle that you can practice. Maybe that's an adverb.
But you were using it as a noun, which is why I was wondering why you chose it.
Oh, interesting.
Okay.
Okay, that's a good
Thank you.
question.
Yeah, resiliency is such an important area, and the panelists put together some resources, and one of them is about protective factors. Do you want to talk a little bit about protective factors, Allie?
Sure. So some protective factors are, I think of them as maybe the safety net or the buffer for stress, so that when stress happens, when inevitable stress happens, we have this trampoline or safety net that enables us to bounce back. And so some of those factors would include, is there a particular resource that we included? For,
Let's see, I put into the
that way I could speak directly to it.
there was a protective factors for children from childtrends.org. I can put it in again. And Control V. And while Ellie's looking that up, if others who have a question, please put your name in the chat and we will call on you to ask your question.
And so yes, so this resource that I included for everyone to be able to look over really kind of captures many of the points that many of us brought up today as things that we all can go home and do. So that would include sensitive and responsive caregiving, making sure that, you know, now that we know how important and critical this is, we can go to the children in our lives, to the adults in our lives, and help inform one another of, you know, the criticalness to being present and connected with one another. Making sure that basic needs are met. I think you heard from Gwen all the ways that our agency JFCS is working with families and the entire community to both volunteer and donate basic needs such as food, shelter, clothing, medical and mental health care. That was protective factor number 2. Emotional support for children, another advocacy effort that JFCS is working on, and this is in Sacramento, our state capital, that we're lobbying to promote social emotional learning in all schools. It's not necessarily commonplace right now, and so there's new legislation being put through to get better standard social emotional learning and to have teachers trained in the methods to be able to support our children even better.
Thank
So
you so much, Ellie.
Okay.
We have a couple of additional questions. So I want to call on Atieno Mboya, and if you could direct your question to Gwen.
Thank you very much. I joined the session late, so my apologies if this was covered already, Gwen. I've heard that from the session that loneliness is a state of mind, but I'm also aware of at least one study that was done through McGill, where they show a correlation between increased gray matter in certain areas of the brain and loneliness. Okay, so like areas of the brain associated with reminiscing or planning future activities. The volunteers that had a lot of gray matter in these areas were actually the lonely people as well. So I'm really curious about that. Thank you.
Absolutely. I think that that's, we definitely see signs between the correlation between loneliness and, increases in cognitive decline. And so I think that a lot of our programs focus on building the strength of, working with our seniors in terms of, life review, giving their life value and really create those bonds and of connection. It's so important in terms of, brain health, because as we know, it really is loneliness does affect that part of the brain. That helps, sorry.
Thank you. Thank you so much, Gwen. I want to invite Linda Kurtz. She wrote a comment in the chat about her experience with CASA. And after she talks a little bit about that, if Kiyomi could comment on experience, if any, with foster kids. Linda, are you available to share your comment?
Yeah, I think I need, yes, happy to. Hello, everybody, and thank you each and every one for your caring for this empowering issue and program. I just wrote in the chat that my impetus for joining National Council of Jewish Women was that in the 1980s, when it was still a volunteer or program, NCJW co-founded CASA, Court-Appointed Special Advocates for Children in Dependency and Foster Care. And I was a very busy vocational counselor with State Department of Rehabilitation and mother of 2 toddlers. So I could not actually volunteer for CASA, but I wanted to join an organization and pay my dues to an organization that recognized the need for not just caring one-on-one for children in foster care, but developing the competency to represent those children as official members of the court. Thereby the title, Court-Appointed Special Advocates. And soon, a few years later, after I joined, just to support this organization, my kids ended up in an elementary school, a third of which were children in foster group homes. So as an active volunteer, when I wasn't at my job, I would work with the children who had not even a single foster parent. They were in group homes, and these wonderful group leaders could not volunteer at school and left it up to those of us who could devote extra time to these children. Then I would go to my job and I would work with adults with disabilities, but many of them had been in the foster care system as children. And also many of them had been in prison and come out. And one man had tattoos covering both arms and his neck. And one of the things he asked is, can the state pay for me to remove my tattoos? We ended up getting him a good job and referring him to a place that did remove his tattoos, but I saw firsthand, going from working with children to the adults who'd been through the system with 8, 9 foster care residencies, some excellent and some horrible, providing more traumatization. I just saw so much the benefit of that one-on-one caring, compassionate friendship, and also court trained, competent advocates for one-on-one children in foster care. And the issues that were explained today on loneliness, isolation, and certainly the trauma.
Yes.
Small trauma, but cumulative. And I just can't say enough for what I have witnessed with the CASAs that I have met through the years.
Thank you. Thank you so much, Linda. I want to invite Kiyomi to comment, respond.
Yeah, so Linda, you bring up a really good point, and there is definitely a link between foster care and the juvenile justice system, and that's actually one of the areas that is being studied to figure out where we can actually break that link. We also know that there is a link between foster care, group home, and placing a child outside of their community and a progression to human trafficking. And a lot of this is due to not having a steady foundation and steady social support, or having social support that you don't really feel like you can count on. One of the interesting things is that a child will not necessarily distinguish always negative social support with positive social support, and they just know that they are supported. And this is actually one way that a lot of the traffickers can lure children into being trafficked, because they are that one person, that one friend, and a child's not necessarily able to distinguish that this is a negative social support. So it is important for children who are in foster care to have a positive mentor, and it really just takes just one. So we know this because we also see this in terms of the juvenile justice system and children having maybe one person that they confided in who was actually using them. Same thing with trafficking, and same things with a lot of trauma within the foster care system as well. So it is important to have that one teacher or that one foster parent or that one advocate who can actually look at the child and provide a just almost like a sounding board, but listen and validate the child versus using them.
Okay, thank you so much, Kiyomi. I see that Erin Saberi has a question calling from Sacramento.
Yes, thank you, Emily, and thank you for this wonderful panel. I have a question for. I really appreciate this connections between and also survivors and their loneliness. We're in Sacramento. We've just had 2 very tragic and high-profile domestic violence cases resulting in several murders, including 3 children. And a court-appointed supervisor. And we're, in our community, the domestic violence folks have all rallied and are looking at, searching about answers. And of course, things have come up about gun relinquishment laws and whatnot. But we as a Women's Commission in Sacramento are struggling. You've talked about volunteering and supporting women and loneliness. And I think that for women who are grassroots and volunteers and not necessarily trained, what are some ways we can support victims of domestic violence and or domestic violence prevention in our communities, for folks who aren't plugged in but who want to be and want to put their arms around, for example, the wife and children of the man who was just killed. Do you have any tips for us?
I'm going to direct that to Beverly.
Thanks, Erin. And I look forward to working with you in the future. We're very close to our commission on the status of women in San Francisco and look forward to working with our commission
Likewise.
partner in Sacramento. Well, this was a tragic case that happened. And as always in tragedy, we are going to see possibilities for, I think, human connection around this and also policy improvements. And so, you know, I think your question about grassroots folks that want to help, every community in California has domestic violence agencies, and every community in every county in California has a domestic violence shelter, and they usually operate, although not in San Francisco, the crisis line. I would say in California, to take the domestic violence training is a great step forward for people who want to be just more knowledgeable and more helpful in their communities. Yes, it's a 40-hour training, which seems like a lot, but it's usually in most communities divided up by a weekly meeting. Most of them are on Zoom now, which makes it a lot easier. And there are strategies to help, many of which we talked about today. I also think from a policy point of view, this case, which is just so tragic, brings up so much about gun violence, but also brings up training and more knowledge about and raising awareness about supervised visitation. This is so often seen as a strategy by the courts as a way to facilitate visitation with a parent that has been violent in the past. But I'm not sure we always take the past violence as seriously as we probably should. You know, believe survivors. That's really, I mean, if one message could go out to the courts and the communities, right, is believe survivors. When survivors go to court and say, it is so dangerous for children to be with this partner without someone else there to supervise that visit, that's a very strong statement and should really be taken seriously. And so I really think we'll probably see legislation, maybe from Susan Rubio's office in Los Angeles, but maybe some other legislators as well, about training people who are supervising visitation. And I will say in so many areas that there may not be enough professional supervisors, which is almost every county in California, we are seeing family members being asked to supervise visitation, and it's not safe, and it's not objective. So there's a lot to do here, Erin. I really appreciate the question. Of course, we don't have all the answers. If we did, we'd see fewer of these tragedies, but let's work together. Thanks.
Thank you so much, Beverly, and thank you, Erin. Now I want to turn it over to the mastermind behind today's session, Antonia Levine. She has been busy managing all of the Zoom back and forth, and she has been supporting this particular session since November. And so we've been waiting for all of you to arrive today and to share in this moment since November. And we're just so delighted that all of you could join us. Antonia is going to offer some summary and some parting words.
Thank you so much, Emily, and thank you all for joining us today. What an impressive group of women leaders. Many of them representing two over 100 years old women organization fighting internationally for women's rights, which means for human rights, because women's rights are human rights. I'm very grateful to our speakers, especially to Nancy Goldberg for bringing this important issue. And I'm glad that our speakers broad perspective from each about each of the aspects of loneliness and brought so much good advice and resources for all of us to provide our constituencies and groups with these resources. We cannot speak about empowering women and girls without removing the barriers to that. And especially in pandemic times, we need to focus on support systems and resources and good advice that will bring this empowerment and environment that allows empowerment for women and girls. Thank you all for being here today. I'm so grateful for the support for this event of my sisters from the National Council of Jewish Women, San Francisco, and the International Alliance of Women. It's great to have you here today. And I want to acknowledge also the United Nations Association of San Francisco for the support that they provided. Thank you so much again. Thank you to Marian Belker and to Nancy Kirshner Rodriguez for opening on behalf of the two main supporting organizations. Emily, as always, you were outstanding. Welcoming and just lovely moderating. Thank you so much.